Hello, this is Dr. Samin Afzal from Afzal Eye Clinic, Hyderabad. Uh, Today I will discuss about the corneal incision and the side port incisions prior to start the phacoemulsification, which is the first step of our surgery. Now, whenever we give a corneal incision, we should select the site of a surgical limbus, which is slightly 1 to 2 millimeters behind the gray line of the cornea. A surgical limbus is heavily embedded with the stem cells, and we know that the surgical limbus starts when the corneal descemet lines ends. So if we have approach through the surgical limbus, then definitely we are going to save the cornea, and different layers of the cornea, descemet membrane of the cornea is not disturbed during the surgery, and it cannot lead to the fish mouthing or corneal opacities. And secondly, when we give side port incision, we should go ahead with the two incisions, opposite incisions, one at 3 o'clock and other at 9 o'clock, slightly 9 or the 8 o'clock side. And both these incisions should also be the posterior limbal or the surgical incision site, because the goal is the same, as we have to save the cornea and the substance of the cornea and details of the cornea, and we have to avoid the opacities of the cornea and disturbance in the descemet membrane. And the main advantage of giving the two side port incisions is that we also need to neutralize or negate the astigmatism against the rule in aged persons, when we need to provide a normal or nearly normal post-operative visual acuity 6/6 or 6/9. And we also gave the two opposite side point incisions to facilitate the aspiration of the cortical material after phacoemulsification is completed, and the cortical material which is stuck up at 12 o'clock and 6 o'clock positions, we need the help of the side ports to have our approach through the side port. So just we will start, and in this video I can demonstrate that how can we give the surgical incision. This is the start of phacosurgery, and we are using the 2.8 diamond knife, and our approach is exactly at the surgical limbus, which is slightly behind 1 millimeter behind the corneal gray line. And this incision is exactly the two-step incision. We gave incision in the substance of the stroma of the cornea, and then we pierce into the anterior chamber. So the corneal incision should be two-step incision. Similarly, at 8 o'clock, we also use the side port 1.4 millimeter diamond knife, and in the opposite side we have our approach through the surgical limbus, and we should give two side port incisions, and I have already discussed the advantages of these